this next skill that I'll be performing is a central line dressing change. Hello, my name is Sarah McCain and I'm a DVL nursing student, and today we are going to be changing your central line dressing. I would verify my patient's name and date of birth. And I would come in and wash my hands and get ready to do the dressing change. So for the central line dressing change, I would lower the bed and make the patient flat to reduce the risk of air embolism. And I'm going to don my gloves to remove the old dressing. And if anyone was in the room, I would ask them to leave the room or to don a mask. And I will also be putting a mask on my patient today. And if I didn't have a mask, I would turn the patient's head away. So I'm going to don the mask on my patient. My patient is wearing his mask. I'm going to reveal the central line. And I will begin removing the old dressing. Be removing it away from me. Very gently not to disrupt the sutures. And I would dispose of that. Once I have removed the old dressing, I would assess the central line for Arita. I would say that there is no redness, no bruising, the sutures are intact, and there's no indication of infection. So once I have removed the old dressing, I'm going to take off my old gloves and wash my hands. And then I will begin to put on my sterile gloves. Only touching the inside. These gloves are very tight. And I have very sweaty hands, so only touching the inside of the glove. And I would pinch out the other glove, only touching sterile to sterile. These gloves are very small for my hands. And I would be careful not to reach over my sterile field and not turning my back from my patient. All right. So now I can touch sterile to sterile, kind of fix these gloves a little bit. All right, so next I will take out my swabs to clean the area. And I would clean all around. Make sure I'm getting under the lines. Dispose of that. Grab a new one. And I'm going to contaminate my pinky to hold down. And I'm just going to lift up these lines and get all around that hub really good. I would do a pretty big border. Everything that is going under the bandage needs to remain clean. And once I had finished cleaning, I would insert the bio patch to go underneath. And once that was in place, I would let all that dry and then I would cover it with an occlusive dressing. And once I had the dressing in place, I would label the dressing with the time that I changed it, my initials, the date and time, and I would document how the patient tolerated the procedure, the ARETA, and I would clean up my supplies.